Lithium-induced nephropathy. Definition. Lithium and the beer used in therapeutic and for smokes. On the 15th year in the 19th century, the reader and the Hymen and the advocate they use of the lines as type for the treatment.
Lithium-induced nephropathy. Via the New England Journal of Medicine. A 59-year-old man with a history of bipolar disorder was admitted to the hospital after a fall. He received a diagnosis of multiple fractures of the head and spine. The fractures were managed non-operatively. During the hospitalization, his urine output was noted to range from 4 to 6 liters per day. The patient had taken lithium for 27 years before discontinuing the medication 8 years before the current presentation because of mild hyperparathyroidism and renal insufficiency. Serum creatinine level, 1.5 milligrams per deciliter, 130 mmol per liter. While he was immobilized in the hospital, his serum sodium levels rose from 138 millimoles per liter to 149 millimoles per liter, with a urine osmolality that was inappropriately low, 262 mg per kilogram. The urine osmolality did not increase with the administration of desmopressin, which confirmed a diagnosis of nephrogenic diabetes insipidus. As part of the evaluation for the fall, computed tomography of the abdomen and pelvis with contrast enhancement was performed, and the results showed numerous small renal cysts in the cortex and medulla of both kidneys, axial, panel A, and coronal, panel B, views, with a non-standard window used to enhance visibility of cysts. Lithium is known to cause tubulointerstitial nephropathy, which may be seen on imaging as multiple small cysts. Management of this patient's condition included a low-salt diet and a liberal intake of fluids. His sodium level normalized, and he was discharged to a rehabilitation facility.
Application news. Renal fusion and the shall be the cardiac video evaluation in the eyes patient and the fourth one, and the lithium in the considering and the BW treatment also, and the before starting treatment in hospital at the sitting they the music ring or the creatinine clear rings in the recommended and the C in the general at the current lithium and the reflex the glomerulin and the filter rating and the fog to for how you need colleagues in the people.
So here's an example of a relatively unique diagnosis, but one that I think may allow you to make a very specific diagnosis in a certain patients. Now, as you can see on these T1 post-GAD and T2 weighted images, there are innumerable tiny cysts scattered throughout both kidneys. Now, interestingly, notice how these aren't within all of the renal parenchyma, but rather all of these little tiny cysts, which measure 5 or 6 millimeters in size, are all clustered right at the renal cortex. This was actually a patient who had a very unique history. This patient had a history of chronic lithium use for a psychiatric disorder and had known lithium nephropathy. And this is exactly how they can look. Classic lithium nephropathy, whether on CT or MRI, will present with innumerable tiny cysts along the renal cortex, right at the surface of the kidney. If you see that, the first thing you've got to do is look into the patient's medical record, see if there's any history of lithium use, and if there is, you can make the diagnosis of lithium nephropathy.
The pros and the cost. And the pros and the linty had been in the most effective at the psychopath pharmacology, although in the long and the treatment of the patient. In the way recurring unipolar and the bipolar affective disease. And the cause on the of the city is fitted at the society and the returning in the using and the lithium induced nephropathy a weakening Eventually, in the misfitting and the terminal and the night disease, and the weakness, and the dialysis, and the or kidney transplanters. You see uplifting the Ecuador. A young Guayaquil hospital patient in the weakness and the failure rate of the hypertension and the recipe and the lithium and the glory the salt ox, the substitute tier and the forever salt, the 4-week study and the effects of the lithium acts and the model stabilizer program.
Using lithium to treat bipolar disorder could have a bad effect on the kidneys. According to UPI, lithium has been shown to suppress a certain enzyme that protects kidneys from failure. A new study is showing concerns about the commonly used yet seemingly effective tactic. Those who take it at high doses for long periods of time to treat mental health illness may have an enzyme known as GSK3 pushed down to unhealthy levels. That enzyme keeps protein from spilling into the urine and prevents kidney failure.
Conclusion. In the lithium they drugs or the toxic and the 4D treatment or the bipolar disorder and the preventing recurrent 6 and the 60 and the 10. It is a huge sulfuric cause of the brahma the fluid in the mind and the precipitate and the symptom in the train on the night on the off passing things.